Hi, I'm Michael Fitzgerald. I'm the editor-in-chief of Harvard Public Health Magazine. I'll be your moderator today. Today, we're focusing on the program to encourage active, rewarding lives, or PEARLS. PEARLS helps older adults who are experiencing depression with one-on-one coaching, either in their homes or in their communities. Our panelists will give us an inside look at PEARLS, and will also examine the research about the program and talk about the unique mental health challenges facing older adults. Joining me today are Sherry Wu, Research Coordinator for PEARLS at the University of Washington Health Promotion Research Center, Joel Hernandez, a PEARLS coach at Inland Caregiver Resources in Riverside, California, and Mercedes and Baltazar Molina, a married couple who participated in PEARLS. Sherry, we'll start with you. Why older adults?
Thank you so much for the introduction and welcome, Michael. It's really a pleasure to be here with Joel and Balthazar and Mercedes. Really glad you asked why older adults, because currently, the statistics shows that 1 in 5 older adults in America live with depression. And what's really disheartening to me is that among those who are living with depression, their symptoms have historically been, both under-recognized and also left untreated. In fact, half of older adults living with depression are not recognized as being depressed by their primary care physicians. There continues to be a myth that depression is a normal response to life changes and diseases in older age, which is simply untrue. Most older adult depression care programs continue to be based on the medical model, which means, your typical therapy, counseling, or treatment through medication. While long-term psychotherapy, works for some folks and can be very effective, it might not always be accessible or preferred by everyone. And, older adults are also less likely to seek mental health care. One of the reasons is stigma. Unfortunately, talking about mental health can still be seen as a taboo and can be really difficult to talk about. And also structurally, access to mental health care continues to be inequitable for older adults, in particular those of color, older adults who speak languages other than English, are low income, or live in rural or remote areas where there's just not a whole lot of resources available to them.
So Joel, you are a coach. What happens in a PEARLS session?
Thank you. Well, I think one of the first things is trying to build a little bit of rapport, making them feel a little bit more comfortable so they could be able to feel comfortable in our conversations. What happens in our sessions is that I explain our problem-solving treatment, our PST, we call it, trying to explain a little bit the program, what is the structure, how the structure works, and how the structure is going to be able to help them out. From that point on, depending on where they're at, we pretty much meet them where they're at, both mentally and physically. That could mean that, we could do the sessions in persons, either at their place of residence or anywhere in the community. That's physically. What I mean by mentally is that wherever they are, sometimes participants are ready to, take charge and start working on heavy issues. Sometimes they're not. Sometimes it takes them maybe a little bit smaller steps to get started. So meeting them where they're at, both physically and mentally, and making them feel a little bit comfortable in explaining our model.
And Joel, you use the word coach, not counselor, in your title. That's one thing that might be different from normal therapeutic kinds of things. What are other differences from other kinds of therapy with the program?
Well, in itself, PEARLS is not counseling. It is not counseling at all. Rather than talking about problems or counseling about the problems, what we're teaching them is this problem-solving treatment, how to be able to solve problems. So rather than talking about the problems, we teach them how to solve the problems, teach them this skill set. And just to clarify, and this is what I tell a lot, is that it is not therapy. I am not a therapist. Although it's not therapy, this could be very therapeutic. So in essence, it's not therapy, but it is therapeutic to a lot.
Mercedes and Baltazar, you were both clients in the PEARLS program. How did you learn about it, and how did you decide to participate?
Ok, fui a una feria en un hospital donde hacen sus ferias de de tener todo para que la comunidad sepa todos los beneficios que hay aquí en Riverside. Y ahí yo en el hospital agarré un folleto y me explicaron que ustedes ayudan a las personas que tienen depresión o que seamos pues mayores de edad también y nos podían ayudar para encontrar lo que buscamos. Y después le dije a mi esposo, porque mi esposo dejó su trabajo y yo pensé que él necesitaba la misma atención que yo porque a mí me ayudó bastante. Entonces le dije que si quería hablar con ustedes para que ustedes le ayudaran a mí. Parece que sí le ayudó a él que les diga.
Yo conocí el programa por parte de mi esposa. Ella me explicaba y me explicaba que había esta oportunidad de hablar con alguien para que nos ayudara, pues más que nada a no tener estrés, a no tener presión por diferentes causas. Yo le decía a ella que yo no ocupaba este programa, que yo estaba bien. Pero el año pasado perdí mi trabajo, tuve un accidente, perdí mi trabajo y se empieza uno a estresar. ¿Qué va a hacer uno sin dinero, sin poder trabajar para cubrir todos los gastos de la casa? Entonces acepté entrar, hablé con Joel un día, me hizo unas preguntas, hablamos y me dijo que yo calificaba para entrar dentro del programa. Y así comencé. El programa a mí me ha ayudado a salir del estrés, de la depresión y me he sentido muy bien. Me ha ayudado a encontrar otros caminos para poder realizar otras cosas. Y la verdad, yo me siento agradecido con ustedes y lo he recomendado a otras personas. Pienso que mucha gente necesita este programa. Yo le hacía una observación a Joel de por qué este programa también no se enfoca más en la gente más joven. Hay muchos jóvenes que están perdidos y Joel me explicó algo acerca de eso. Entonces, yo me siento bien, me ayudó bastante, sigo aprendiendo cosas y les agradezco. Muchísimas gracias.
Thank you, Baltazar. Mercedes.
A mí, como le repito, a mí me ayudó para cambiar el modo de vivir la vida cotidiana. Me cambió para tener las herramientas para poder disfrutar más de las cosas que uno hace, porque cuando uno tiene depresión, pierde el interés de todo lo que a uno le gusta. Y cuando platica con alguien que la motiva y le ayuda, pues uno cambia la expectativa para disfrutar más de todas las cosas que nos gustan. De aprender que la vida tenemos que dar gracias a Dios y ser gratos por tener la vida, pues que nos dé un día más de vida todos los días. Y me ayudó mucho y mi esposo decía que no le ayudaba, pero pienso que el que dice que no, pienso que el que se niega a aceptar la ayuda a veces lo necesita más que el otro. Es lo que pienso. Cuando decimos, no, yo no necesito ayuda, estamos como gritando, sí, necesito ayuda. Cuando decimos, yo no la necesito, sí la necesitamos. Y pues a veces no lo entendemos hasta que agarramos las pláticas con ustedes y nos damos cuenta que sí nos beneficia mucho y nos ayuda a seguir la vida diferente y aprender a dar gracias por otro día de vida.
So that's great. Okay, thank you. So Sherry, to Balthazar's point, tell us about the origins of pearls and why it's delineated or structured the way it is, targeted at certain ages.
Yeah, Well, Pearls was created over 20 years ago in partnership with the social service agencies here in Seattle, Washington. And some of our original partners included our local area agency on aging, the Seattle Mayor's Council for African American Elders, community-based organizations, and even senior housing providers. And so the original intention was that our local partners are noticing that their clients were experiencing depression symptoms and that there is a gap in service that fits the needs, especially for these older adults. And so together with the researchers here at the University of Washington, collectively, they designed Pearls. And so, the longevity of our program is really because it was designed with these community partners, both to address their clients' needs and also leveraging the strength of them as an organization. We were very mindful in not duplicating the typical process of research where teams would design a program or intervention and only approach communities to test it out. Because these organizations are already known in their communities and they're providing essential services that are already addressing the various determinants of health. And so a program like Pearls can be easily embedded within these services that they're already providing and be adapted to some of the different needs.
Joel, who is Pearls right for, and how do you connect those people with the program?
So Pearls is part of a prevention early intervention program. So this program is designed for people who are either at risk or starting to feel some depressive symptoms, or perhaps they're already experiencing these depressive symptoms, but it hasn't been long-term, meaning not longer than 2 years. The way in which we gain some of our participants is a variety of ways. When we do outreach, we go into the community, either senior center, senior complexes, community center, wherever a senior is, we try to go down there and go to where they at. Again, this is part of, we meet them where they at. The other thing that I forgot to mention, how do we get participants to the program, is because we do work with the community itself. So members from the community also refer them. Kaiser refers some of our patients to our program. We have other like respite agencies, other medical facilities also refer clients to us. We are a resource center for the community, so we also get referrals through our agency as well.
So Pearls is focused on health and happiness in people's later years, and so Mercedes, Baltazar, how would you describe your experience and what advice would you give for other older adults?
Yo me beneficié porque en la etapa de mi vida que yo estaba, empezaba yo a deprimirme. Entonces me dio confianza el estar con alguien profesional como lo eres tú, Joel, y eso me abrió para poder decidir que se pueden hacer más cosas si uno tiene la agente profesional que te da las herramientas y te da la dirección correcta para seguir adelante. Yo este programa lo recomiendo mucho a las personas. Hay muchas personas que necesitamos este tipo de ayuda. Y la verdad, me siento yo agradecido y sí lo recomiendo bastante. Así me ayudó a mí.
Una de las primeras que me ayudó es que es gratis, que no cobra nada y que realmente sí nos sirve a nosotros para estar mejor, como le dije, y a mí me ayudó a mí y a mi esposo. Entonces yo también estoy muy agradecida de esa forma, porque yo también la he recomendado a otras personas que siento que también la necesitan. Y me dicen que sí, que han hablado con ustedes y que les va bien, y a mí me parece muy buena ayuda de parte de ustedes para que uno se sienta mejor cada día. Gracias otra vez por su programa.
Thank you. Gracias. So Sherry, you mentioned earlier that there's some new directions that Pearls is looking to expand in. Can you tell us a bit more about where Pearls goes from here?
Yeah, absolutely. So, we really came a long way since the early 2000s when the program started. And so far, more than, over 9,000 older adults in 133 organizations across 26 states have participated in Pearls. Our Pearls agencies have been successful in engaging a wide range of older adults, from veterans to caregivers to older adults who are unhoused, and to people of all ages living with disabilities. And so, Michael, you asked me earlier what constitute as a older adult. And while 65 might be the most common eligibility for the program among some of our Pearls partners, it really varies by organization depending on their funding requirements or the needs of their community. We have some Pearls organizations that serve people who are 50 plus, or as I mentioned earlier, people of all ages living with disabilities. And so our team right now, or has been, under the University of Washington Health Promotion Research Center. And we're currently in the last year of a 5-year randomized control trial that's funded by the CDC as one of their prevention research center projects. And so the goal is expanding depression care for older adults in underserved communities. And so this time around, we're taking more of a proactive approach in reaching out to these organizations, and by creating, different messaging and dissemination tools that really resonated with organizations from some of our formative research work. And we're really looking forward to sharing findings when they're available. But, outside of our research activities, our team also provides the online Pearls training that Joel and some of our other coaches have gone through. It used to be in person, but during COVID-19, we shifted to an online Pearls training module to also respond to the needs of our partner organizations too. We also conduct technical assistant calls and host learning collaboratives. So think of it as a community of practice where Pearls coaches can, learn from each other, share resources. So it's not just a one way from, information sharing from us as researchers back to the community, but really it's that peer-to-peer support from one organization to another. And they'd be able to learn from each other, the strength and the challenges, and support each other in that way. Our team also provides clinical supervision. And so Dr. Mark Snowden is one of our principal investigators, who is also the chief of psychiatry at the Harborview Medical Center in Seattle. And he works with some of the Pearls coaches in supporting their clients.
Well, your enthusiasm and your excitement for the work really comes through. And I want to thank all of you so much for being here with us. And gracias, Mercedes and Baltazar, for this discussion, this thoughtful discussion of it. I would like to encourage members of the audience to join us again on May 7th, when we'll be talking about how to help a program that helps teens in crisis. Thank you very much.
Muchas gracias.
Thank you.
Thank you.